My presentation is about Picture Exchange Communication System, or PECS. What is PECS? It allows people with little or no communication abilities to communicate using pictures. PECS is simply using pictures to communicate. It was developed by Andy Bondi and Laurie Frost in year 1985, and it was first used at the Delaware Autistic Program for preschool students who were diagnosed with autism. PECS is based from B.F. Skinner's book Verbal Behavior and Broad Spectrum Applied Behavior Analysis. Goals and intended outcomes. First one is to develop functional communication. This is the primary goal of teaching PECS to children: to develop social skills, preventing and reducing inappropriate behaviors. Studies have shown that PECS can prevent and reduce inappropriate behaviors to children. Independent. Children become more independent. Speech. Research have shown that some learners using PECS also develop speech. PECS consists of 6 phases. Phase 1. How to communicate. The child learns to exchange single pictures for items or activities he or she wants. So the woman in here, as you can see, we call her communicative partner, who immediately honors the exchange as a request from the child. Phase 2, distance and persistence. In here, the child is still using single pictures. Also, the child learns to generalize this new skill in different places, people, and across distances. The child is also thought to be more persistent communicators. For the phase 3, picture discrimination, the child learns to select from 2 or more pictures to ask for his or her favorite things. In here, the child is using 2 or more pictures. These are placed in PECS communication book. Phase 4, sentence structure, attributes, and language expansion. For the sentence structure, the child learns to construct simple sentences by using I want picture followed by the picture of the item being requested, and it is placed on the detachable sentence strip. For the attributes and language expansion, the child learns to expand his or her sentences by adding adjectives, verbs, and prepositions. For the phase 5, responsive request, the child learns to use PECS to answer questions, what do you want? And for the last phase, commenting, the child is taught to comment in response to questions such as what do you see? What do you hear? What is it? They learn to make up sentences starting with I see, I hear, it is, I feel, and etc. For the last part of my presentation, I have here a research study about PECS. I chose a critical review by Julie Bolton. In nonverbal children with autism spectrum disorder, is verbal output increased for those who engage in picture exchange communication system. The objective of this paper is to critically evaluate the existing literature on PECS training to determine if it is effective in increasing verbal communication in nonverbal children with ASD. From my previous presentation, I've mentioned in the goals and intended outcomes of PECS that PECS also develops speech to children. For the methods used in this study, search strategy, Electronic database. Articles related to the topic of interest were found through electronic database, PubMed, Scholars Portal, ResearchGate, and SciNet. There were 7 studies which met inclusion criteria. Selection criteria. To meet inclusion, studies must have included participants 18 years and younger with ASD diagnosis, a nonverbal communication profile, 0 to 10 spoken words, PECS training, outcome measures that included verbal output and communication functions. For the data collection, there were 2 multiple baseline designs, 2 single subject designs with changing criterion, 1 randomized clinical trial, 1 non-randomized clinical trial, and 1 qualitative research design. The overall findings of this study is that there is compelling evidence that PECS training does increase verbal communication in nonverbal children with ASD. It increases in mean length of utterance, joint attention, ability to imitate, and decreases in problem behavior were some of other common benefits found. Another findings. There was also a common finding that 100% of PECS gains were maintained. PECS training was quick and easy to acquire. This allows PECS to be implemented in a wide variety of settings with a range of participants such as teachers and parents.